Hello, CASK community. Welcome back to The Roar, your one-stop shop for research-related information and other happenings in the CASK community. Happy New Year to everybody. I'm excited actually to kind of be back doing this series, and I'm going to try really hard this year to make these much shorter, like 5 to 7 minute little sound bites for you that you can listen to just doing whatever you're doing, but you can pop in the earbud and just listen. You don't have to watch, although it is a video, but no need if that's going to get in your way of listening. But I'll try really hard. I did try last year. I just often didn't make it to do that. So what I want to talk about today is first and foremost the Critical Path Institute request for proposals from the Translational Research Accelerator that just came out the 20th, Tuesday the 20th. I also want to talk about Rhythms for Rare, and I want to talk about how we can better use this this video series to answer your questions. So without further ado, and to stick to my commitment now, the first thing I just want to say before I jump into CPath though is that, when I was thinking about last year, and I'm not going to run down everything that we achieved in 2025, it was a lot of things. We'll make sure that that's in the annual impact report that will be coming out soon, so you can see all of that. And of course, if you just look back at some of our posts from the end of the year, particularly in December, we really tried to highlight some of that for you, or you can look through and dig through those emails that you may not yet have read from us. But what's really wonderful sitting today here now, January 2026, is to think back 2 years ago, January 2024, and to see what a completely different landscape it is for CASK therapeutic development today. I know you hear lots of things, just tidbits here and there, and sometimes it's really hard to understand the big picture, but what I can say is we are in a completely different position as a community today than we were 2 years ago. There are so many more researchers and scientists and industry partners that are working on and thinking about CASK, and we have multiple therapeutic strategies underway and multiple studies that are helping us understand the disorder better, that are helping us understand its progression, that are delving into specific aspects of it, like the MRI study that will launch this year, the epilepsy study, and others that are ongoing. So this is really exciting, and it's really important to take stock of, because I know drug development and all of that is slow. It is slow, and all of us wish as parents that it would be tomorrow that we could say, oh, I'm going to sign up for this trial, or I'm going to get this drug for my child. But there is so much movement, and the landscape is completely different today than it was 2 years ago. So let's take stock of that. Let's keep working hard, because there's still a long road ahead of us and lots to do and lots to learn. But, the grass is much greener today. So, so as you may have seen, and if you haven't, I encourage you to go read the press release on the 20th. The Critical Path Institute Translational Research Accelerator launched their 2026 BRIDGe request for proposals, and CASK-related disorders are explicitly included. This is big for us. So who is CPath? What is TRxA? CPath was originally created in 2005 by the FDA, and it was in response to an FDA initiative to accelerate medical innovation. It is today an independent nonprofit, and they really function as a neutral convener. They bring together patient advocacy organizations, researchers, industry partners, regulators, etc., including the FDA and other regulatory experts, to really build infrastructure to advance drug development, to support regulatory science, to support data sharing, and to support translational research in particular. They're not working on one specific drug. They really try to build this infrastructure for the whole system, the whole drug development ecosystem. So within the Critical Path Institute, CPath is something called the Translational Therapeutics Accelerator. And that is really hyper-focused on what is sometimes people call the valley of death of drug development. So you can have a great idea. You have a researcher at an academic lab that, is showing something really promising, but getting that into clinic, getting that through the process to actually make it a drug that's accessible to people can be really hard. And so they call it sometimes the valley of death, because you have the proof of concept, but you just can't quite get it to clinic. And there's a whole bunch of reasons for that happens. I think I've talked about it in the past, but if I have, we'll find it and we'll link it in the show notes, or I will talk about it soon. And so they're really focused on how can we avoid that? How can we bridge that valley of death? And so they developed the BRIDGe program, which is Bridging Research and Innovation in Drug Development. And this is a set of grants. And it's different than sort of typical research funding, because beyond just providing resources to, specific disorders or specific research proposals, what they're really bringing is their expertise in regulatory science and drug development strategies, and they're helping the researchers with that expertise and with those resources, so that things can move into IND enabling studies, et cetera, et cetera. And you can actually see that researchers can apply at different, depending on where they are in their own research process. So they take, really promising academic research, and they give them a toolkit to really make these successful therapeutic candidates that biotech and pharma companies will actually want to license. And so this year they are doing something really special with the Polycystic Kidney Disease Foundation. So that's like a very dedicated track to that. But then there also are funding rare diseases, orphan diseases, brain health, and pediatric conditions. And within that sort of family of things, Project CASK is partnering with CPATH to co-fund a proposal. And so it doesn't mean that other researchers from other disorders, of course, can apply, but it means that CASK disorders we're explicitly reaching out, targeting them for more translational research funding. So we're really excited about that partnership and everything that brings now into just, again, this landscape for CASK Therapeutic development. The RFP, so as I said, it was launched on the 20th, and the pre-proposals are due March 16th. We might have a dedicated webinar. We'll get back to you on that with a dedicated webinar with CPATH on CASK-related disorders. We'll get back to you on that. Okay, so the second thing that I wanted to talk about is Rhythms for Rare, and this is a really fun virtual concert that we're putting on. We were thinking about doing it at the end of last year, but just gets a little crazy end of year, and we thought, why not squish it in between Valentine's Day and Rare Disease Day? So it's going to be held on the 21st of February. Bring all those things together, sort of awareness about rare disease, but and love for each other and our extended networks, and love for music. And it's so we're still seeking out musicians for that. And when I say musician, I mean any kind of music. You could be a singer also. You could be a DJ. You want to spin for us. You don't have to be a professional by any means. We have a couple professionals, but we also have just really experienced all the way to novice, 9-year-old who's learning the violin, who's going to share his gift with us. So it's really open to everybody, and we'd love to have more people participating. So reach out to us. Kim Pulliam, Marty Chelland are kind of taking the lead, but you can reach out to anybody at Project CASK. We've put a social post out. We also put a post in the group, so you can check that out for some of the details. But please, please, please join us. It's going to be fun. We have an MC also from the CASK community who is a hoot. She's going to be, the host for it, and I know that she's not going to be able to stop herself from making it fun. So join us, and if you really don't know anybody who's musically inclined or would want to participate, we're also encouraging CASK families to set up watch parties. This is a great way to just get together with people. It's not going to be a super long concert. We're looking at maximum 1 hour. It's going to be 1 p.m. on, so Saturday the 21st, 1 p.m. live, 1 p.m. Eastern live, and then a second showing 7 p.m. A recording will be played 7 p.m. Eastern. So it's for anybody anywhere in the world. Everybody can therefore participate or listen and have a watch party. And it's a great moment to also share with people that come to your watch party about CASK and Rare Disease Day and showing our colors. So yeah, let's get involved in that. And then last thing, and I hope when I put all of this together, I have kept my commitment to all of you. The last thing is just really send in your questions. I want to use this time to be able to answer questions that people have about anything related to CASK that, you saw something posted, you want to understand more about it, you have questions about, I'm not going to talk about specific children, that should be more private, but you have questions about anything that's happening in the therapeutic development space and the research space, send your questions in, and I'll try to do my best to answer them on the Roar, and if I can't, I will make sure to reach out to people who can answer them and get those answers to you. So send us questions. You can always just DM me, but you can also send through hello@Project CASK or research@Project CASK. We keep an eye on both of those. So we want to make this a useful platform for you also, not just to share what we're all doing, but to answer questions that you have. Okay, so that's that. I'm going to do my best to edit this down to 5 to 7 minutes, and wishing everybody a really good start to the new year. We'll be back soon, and until then, keep kicking CASK.